Hi, I'm Lisa Ferrens. This is actually part two of a two-part vlog that we're doing on some of the medication myths that we're often confronted with in the therapy process. And the reason why I wanted to dedicate extra time to this is because there are so many people out there who are needlessly suffering with depressive mood and anxious mood that really can be debilitating and even incapacitating in terms of their daily functioning. So although I want to again reiterate that it is never the responsibility or the appropriate job of a clinician to prescribe medication, I do think it's appropriate for us to be talking about the possibility of medication and to listen closely to the concerns that and the fears that our clients might have about even bringing this to their primary care physicians for further exploration. So in the first vlog, I talked about some of the medication myths that include, I think it's a sign of weakness to take medication, and I'm afraid that it's going to have an adverse impact on my thinking and my judgment. And what I want to focus on today are two additional medication myths that I think often come into play. And the first is, if I agree to go on medication, that means I'm going to need to stay on it forever. And it is really important to let our clients know that we can always be in support of what's called an experimentation of going off medication once they've gotten to a place of full remission. And so the concept of remission is something that I want to emphasize as well, because many clients will have a response to medication, but they are not necessarily in full remission. One of the most objective ways that you can measure remission is to give them the PHQ-9 and to have their score be less than 5. So once they get there, and obviously that's going to be done with a lot of support from their doctor, making sure they're on the right dose, making sure they're on the right medication, if necessary, augmenting the dose that they're taking. Once they're there, the rule of thumb is to keep them on the medication for 6 to 9 months. But then we certainly would be in support of experimenting with titrating off their medication, again, under their physician's care, to see where they land and how they do. So I think once we kind of reassure our clients that this does not mean that you're going to stay on drug forever, and that this is still certainly within your control, you can decide if and when you want to begin to go off medication with the help of your physician. I think that helps to make it a more manageable possibility for our clients. The second thing that I want to just quickly mention is that many clients will be opposed to medication because they'll say, I've been on drugs before, medication before, and it didn't work. That's a very important opportunity to explore what medication were they on and how long did they take it? Because people have often said that to me, and then I find out they took Prozac for 2 days, and then they didn't like it, and so they went off Prozac. And now they have this idea in their head that antidepressants don't work. So make sure that you have that conversation. What were they on? How long did they take it? Were the side effects, outweighing the benefits? And if so, reassure your clients that there are new drugs on the market that have lower side effect profiles, and that certainly we would never encourage a client to stay on medication if the side effects were outweighing the benefits. So having these kinds of conversations with your clients can go a very long way towards encouraging them to get that pharmacological support that can often then enable them to do the work that you want to do with them in the therapy process.